With the coronavirus pandemic, Veterans Affairs medical facilities and those who serve our senior citizens are doing what they can to fight for and protect those who need it most. WAY 31 news anchors Marie Waxel and Pat Simon take a closer look at what's now in place for our senior veterans here in North Alabama and across the state.
The Department of Veterans Affairs is the nation's largest integrated health care system.
Roughly half of our veterans are over age 65, and many have underlying health conditions that could make them even more vulnerable to the coronavirus, which is why top officials in the Birmingham VA healthcare system are taking all the necessary precautions when it comes to protecting the general public and those at a higher risk. Like other hospitals across the state, the Birmingham VA Hospital and the 9 community outpatient clinics, including the one here in Huntsville, have changed their daily operations. They've suspended all elective surgeries and procedures. All patients and staff will be screened upon entering the facility. And it's a uniform screening process, which includes temperature checks and a quick Q&A before you enter the building. Shuttles to and from the facility are limiting passengers to just 50%. And the system has stopped volunteers from coming in, especially since most of the volunteers are senior citizens and at a higher risk themselves. Now, I talked with the Birmingham System Director and her Chief of Staff via FaceTime, and they assured me patients are still being seen at their scheduled appointments. But it's vital that you don't show up to their facilities if you're experiencing any form of flu-like symptoms.
So the good news is it's not a death sentence. The vast majority of people are just going to be as sick as they would if they had a bad cold or some type of mild to moderate flu that they could take home. So only 20% of people get sick enough to require coming to the hospital. So I think that's important to remember.
If you do have concerns, the VA system is also offering telecommunication options. So you can call the facility directly or use their video app to get guidance for any concerns you may have regarding your health. At the same time, we have to think, too, the separation and the quarantining, the social distancing. It's got to be hard to imagine not to be able to personally visit someone who's being cared for when it comes to long-term hospitals and facilities, including our 4 VA homes in the state of Alabama.
But you know, Marie, that is our new reality these days, is only medical personnel are allowed inside those facilities. There are a few exceptions, though, for patient visitations. Still, it's beginning to take a toll on some family members. Like clockwork.
I go every day at lunch and feed him.
For the last 4 years, Mary Rice has spent her lunchtime visiting her husband of 68 years, Kenneth.
Listening to gospel music and things like that.
Right here at the Tut Fan State Veterans Home.
He will be there as long as he lives.
But now that public access has been restricted to this facility and other long-term care homes all across the state to protect against the coronavirus, Mary's visits have been cut off. Only medical personnel are allowed.
Hey.
Here's an example of the kinds of safe communication being allowed now in those homes. This patient using FaceTime to speak with his loved ones.
Absolutely.
Well, administrators like Scott Hurst say that they know the power of personal connection.
I know.
They also know it's still not the same not being there in person.
It's a very stressful time when you have someone that you care so much about and you're unable to actually go see about them.
But for Mary, it's even worse because her husband has Alzheimer's and he can't even talk.
My days are long. I can't see him, but they are so nice. I call every day and they give me an update on him. But it's still not like seeing him.
Not at all. But I did find out that there is such a thing as compassion visits. They are unique for patients like Kenneth, but a visitor has to undergo screenings for protection. That's good enough for Mary.
I will look into it.
And I hope that you're able to reconnect with him.
I do too, and I appreciate you telling me that. I had not heard of it.
For other visitors, including volunteers, the advice is just hang in there and follow these facilities' new protocols for patient visits at these long-term care homes.
Together, we're going to get through this and make sure that everybody's safe on the backside of it.
Together, we're going to get through this. That's great news right there. And here's some other great news. David Hurst there says that he's going to now reach out to Mary to see how they can arrange a special and safe visit with her husband, Kenneth.
Now, for the latest information on